If everyone will please continue to eat, I'd like to invite up to the podium Jeff Breedlove, Chief of Communications and Policy with the Georgia Council on Substance Abuse, and State Senator Mike Dugan.
Good morning, everybody. My name is Jeff Breedlove, and I am employed with the Georgia Council on Substance Abuse. I'm a native here from Georgia, but I am in recovery and spent a number of years in my adult life working in government and politics, and this is one of the people I worked for. But we're here today, and we wanted to do this in front of his community. We wanted to share with everybody that we're awarding Senator Mike Dugan from the Georgia Council on Substance Abuse a Recovery Champion Award. And it's because anytime the recovery community in Georgia has needed Senator Dugan, and there was one day in particular, close to day 40, that we needed his help, he just stops literally what he's doing, gets personally involved in legislation, and he clearly walks the walk, not just talks the talk when it comes to his commitment to the recovery community in Georgia. And as somebody in that recovery community in Georgia, it's my privilege and honor to, in front of his constituency, just let you know how much he means to the recovery community in Georgia. And we want to give him this great award, suitable for framing, mind you, just to acknowledge that Mike Dugan, Senator Mike Dugan, is truly a champion for recovery in Georgia. Mike, we appreciate you so much.
And congrats to State Senator Mike Dugan. We appreciate all you do for this community. Now we would like to start our panel. Thank you guys for coming out. My name is Luke Lukert. I am a reporter for News Talk 1330 WLBB, which you can see live, I believe, right now. Hello, everybody on Facebook. Welcome to the Opioid Crisis, a Community Response 2019. And I'd like to go ahead and introduce you to our panelists. First, welcome Detective Brandon Pederis. Detective Pederis attended the University of West Georgia and then served in the Marine Corps for 6 years. After his service in the military, Pederis joined the Carrollton Police Department, where he's been for 11 years. For the past 6 years, Pederis has been a detective specializing in drugs and gang activity. He is also a part of the multi-agency ACE unit, which stands for Aggressive Criminal Enforcement. Brandon has lived in West Georgia for 11 years with his wife and 2 children. Now welcome Investigator Brian Sims. Investigator Sims serves multiple roles in the fight against the opioid epidemic. He has been with the Carroll County Sheriff's Office for the past 24 years. He's a member of the Drug Task Force, the ACE unit, and the Georgia Bureau of Investigation's West Metro Regional Drug Enforcement Office. Welcome, Investigator Sims. We would also like to introduce Shane Sauls. Shane struggled with addiction for nearly 20 years, 10 of those years with opioids, which he has said was the hardest drug to put down. Shane attended the Blake House in 2011 and has been with them for the past 8 years. He is the Director of Marketing and Fundraising for the Blake House, and he is married to Jennifer Sauls and has 3 children. Battalion Chief Bill Messer has been with the Carrollton Fire Department for 28 years and has been a battalion chief with the department for 2 of those years. He has seen the rise of the opioid epidemic in the area and has seen how Narcan has changed the narrative in responding to opioid overdoses. Bill is an avid fitness enthusiast and lives in the West Georgia area for years with his wife, Beth. And lastly, we have Brian Gibson, who is a licensed professional counselor who has worked for Tanner Health System since 2000. For several years, Gibson has served as the adolescent primary therapist for Willowbrook at Tanner's partial hospitalization program, dealing with issues of suicidal thoughts and accompanying issues in teens regularly. Gibson now manages the Regain, Recovery, and Renewal program at Willowbrook at Tanner, specializing in helping working professionals with substance abuse issues. He is also involved in various community outreach, education, and charity work for underprivileged teens and children, and he's lived in the West Georgia area for 20 years with his family. And now if you guys see you have note cards on your table, if you have any questions for our panelists, we will get to the Q&A portion in a little bit. Go ahead and write them down. We will have somebody collecting those cards and asking those questions of our panelists in just a little bit. But before we get to that, we'd like to kind of have an opening statement from our panelists and to just tell us how the opioid epidemic is right here in our neck of the woods of Carroll County. And I'd like for Detective Paderas to lead us off.
Thank you. Good afternoon. Thank you for having me today. They asked me to just give you guys an overview of what we're seeing here in the city of Carrollton and Carroll County. My job responsibilities primarily with the Criminal Investigative Division are the investigation and to identify narcotics-related cases in our city. We see a little bit of everything out here in the city. We have meth, we have cocaine, heroin, ecstasy, marijuana, of course, in the full gambit. And when I speak a lot of the time to different groups, one of the biggest and most prevalent questions we get is what are the worst type of drugs that we see or we investigate or we get complaints about. And hands down, without a doubt, it's prescription pills. And you know, obviously we see the effects of meth, we see the effects of cocaine, and we deal with it. But when it comes to prescription pills, it crosses all spectrums of people. It doesn't discriminate. All ethnicities, the rich, the poor, the impoverished, the successful. Can you hear me still? I think I've lost you. It affects everybody. All right. Can you hear me now?
Mine works. No, it doesn't.
I don't mind speaking loud with you guys. Just speak up if you can't hear me. But again, we see a little bit of everything out here. But the pills, they cross all spectrums of what we deal with, and that really speaks volumes to what our difficulties are investigating those things, as well as the change in tactics we have to use to try to suppress this. Our mantra with the ACE unit, for the most part, and Brian's going to touch on a lot of this, is we do try to help the users and put away the actual dealers. We understand that because it crosses all spectrums, it's not just for the people that are criminal in behavior or the folks that are just on the streets looking for a quick high. I mean, this affects our friends, our families, our loved ones, fathers, husbands, successful businessmen, and the works. We understand that, and due to that, we have to change the way we look at things at times. Primarily here in the city of Carrollton and Carroll County, we deal with doctor shopping, people that go doctor to doctor, hospital to hospital buying pills. Now, a lot of them are going to abuse those pills themselves. Some people start actually selling those pills on the black market. That's what we primarily investigate when it comes to our unit, is to seek and identify those sales or those people that are actually getting these pills, either from other people, buying them and hoarding them up, and then trying to take them down, cut that head off the snake, and in essence helping our community, taking that poison off the street, and in essence helping the users. Beyond that, we do see a lot of issues and a lot of difficulties when it comes to actually working these drug cases because of that. A lot of these people have their own pill bottles. They're going to have bottles with their names on them, their own prescriptions, and they're going to keep getting them refilled. When we get out with them, our patrol guys, we're very proactive throughout the place, or even us on a search warrant. It's hard to identify, if those pills are being used to be sold or distributed, or if it's just somebody's honest prescription. So it takes a little bit more effort on what we do to actually prosecute that properly and to provide the evidence behind it. It's in my opinion that the rise of heroin has made a comeback in our jurisdiction because of prescription pills. What starts out as doctor shopping or a patient or somebody getting these pills continuously through doctors, the state legislation has started to actually constrict the ability to get those things. They've made it a little bit harder to get. They've bumped them up to a Schedule II controlled substance. I think that doctors are starting to get slight pressure on them now about overprescribing. So I think a lot of our addicts actually start going to the black market in the street to buy this stuff. And at times it actually is easier to get heroin. And what we believe is heroin has actually become easier to purchase. So again, we've actually seen a rise in the past 5 years of heroin making a comeback in our area. And we used to not have that when I started. So we attribute that completely to the opioid epidemic and what we're dealing with. And the problem with these users going to the streets, and even our streets here in Carrollton and throughout the state, is, you know, these dealers, some of them are getting their pills from pill mills where people are creating this stuff in labs. Some people are mixing other things into them or cutting heroin with other substances such as fentanyl. If you guys have heard of fentanyl, 5 granules of fentanyl is enough to be fatal to people. And these guys aren't geniuses, they're not chemists. These are greedy folks that want to make money off other people's addictions. And because of that, we're seeing a lot of overdoses, quite a bit. We saw a 48% increase from 2017 to 2018 in overdose. And that's pretty staggering to us. And this year alone, we're seeing the trend continue already with overdoses and issues that we're dealing with. So it's here, it's a problem. I think Bill Messer is going to speak a little bit about Narcan and some of the success we've had with Narcan, naloxone, actually saving lives. But at the same time, the problem is still there, the addiction's still there, and it's a problem that's bumping up definitely in our community, without a doubt.
And we'd like to go ahead and move to Investigator Sims. What is your experience with the opioid epidemic in Carroll County?
Well, I'd like to also say I appreciate the opportunity to come in and speak to everybody on my view and my experience with dealing with it. I have also been working in the narcotic field for a very long time, and I have seen epidemics of different types come and go, anywhere from the crack to the meth, and now we're dealing with opiates. And are there easy answers that solves all the problems? Obviously there's not. One of the first things you want to do is get the word out, get the knowledge out, so that people know what to look for and what to expect to see if a family member or a neighbor or a friend were to start having issues with the opioids and their addictions. So a lot of people like to sit and think, well, if it happens on the West Coast, it's never going to happen here next door. Well, guess what? It's here. And the problem's just as big here as it is anywhere. Those percentages you just gave on the overdoses, I think that was just for this county. Is that correct? So imagine nationally what those numbers must be. I do know that from 1999 through 2017, there were 700,000 overdose deaths in the nation. So, and you figure in the percentage that Padaris just provided, that's a large number for this one area. A lot of that's attributed to a number of things. Number one, lack of knowledge amongst our people in the community. Number two, the ease of how easy it is to get it. Overprescribing, black market purchases. Now there are some people that actually are making their own pills in their own houses, and there are some new laws come out that are strengthening the penalties for doing so. If someone sells a opiate and they die, they can, the charges in that are much greater now. So pretty much have covered most of my activity. I do a lot. Brandon and I work together in the ACE unit, so a lot of what he had to say was the same views. From the state level, there are some diversion units that are working. They do attempt to find some of the larger suppliers and dealers. They also do some of the street level narcotics, and they will also respond when there are overdoses, should the agencies call and request them to respond to assist in the investigations. So I think I'm going to pass this along and then be prepared for some questions.
And Shane Sauls from the Blake House, what has been your experience with the opioid epidemic here in West Georgia?
Well, for us, we kind of catch the tail end of it. Guys that call the Blake House, a lot of those guys are on the verge of homelessness or divorce or being incarcerated, and so we kind of catch it when it's pretty bad. And majority of the guys that call our phones are those guys that are in that spot. I was that guy 8 years ago, and for us, we start to see once a guy gets there, and because we're not dealing with just him, we're dealing we are dealing with him while he's with us, but we're actually dealing with his family as well. So the effects that we see also is the ripple effect of it, of how it affects the whole family, whether that's a wife or the children that are involved. For myself, I was married. I am married still. I had 3 kids. That was, right there in the middle of the chaos that the opioids were bringing into my house. That it was creating in my home personally, but it is just such an effect that it has on entire families, entire communities, as we all can probably say. It does start with one guy, but the ripple effect is crazy of how it affects the man, the family, the lady, the whole family. So that's kind of where we are as far as what we see is the effect of it in the whole family and the community is bad. I mean, the sad thing for us is we've been doing what we've been doing for in our community in West Georgia. We've been doing what we've been doing for 8 years now, and unfortunately, our numbers have gone down a little bit as far as the men that we have in our program. And one of the contributing factors to that, we believe, is that the sad thing is that guys aren't getting a chance to make it. Guys are overdosing, guys are dying. The fentanyl that the detective mentioned in the beginning, it's real. And so the sad news is that now guys aren't even getting the chance to get the help, that we as a ministry are able to provide, or anybody is able to provide, out there for them. And it's just such a sad thing that we're dealing with. So.
And Mr. Bill Messer, what is your experience with the opioid epidemic? And maybe can you speak a little bit more about Narcan and its effects on the epidemic?
Sure. The one thing that I've seen is due to the publicity of the opioids, people's attitudes and opinions have changed. It's probably a drug that everybody in this room at some point in their life had taken. It provided them with relief from pain. They were able to get better, and they were able to move on. But in some cases, obviously, that wasn't the case. And the bad thing about the drug is that the more that once it gives you a level of relief, your body's going to require a little bit more to get that same level, and then a little bit more and a little bit more. And then once you start taking it for a prolonged period of time, it affects your other systems. It affects your liver, your digestive system, your kidneys. And it just keeps getting worse and worse. And in the old days, people's opinion of the drug was, well, it was prescribed by a doctor. I mean, it's got to be good. I mean, I'm following the label. But yet, and these are not people that we can be in that way. I mean, these are people like us. They're working jobs every day. They're functioning. They're getting by. They're earning a living. They're providing for their family. But then one day the animal just bites them. In the past, we would arrive. Now, the public will tell us, the family will tend to tell us if they take an opioid. Before, they didn't often do that. But all we could do in the past was provide respiratory support. In other words, we'd evaluate them. We could usually determine to some extent what was going on, which basically they weren't breathing. I mean, they were in respiratory arrest, headed to cardiac arrest, and we would just simply bag them, which means we assist their ventilations. But now with Narcan being readily available, and we use the nasal Narcan, which is pretty safe and pretty easy to administer, we can give them an initial dose, assist their ventilations. Usually if we have to, we can follow with a second dose or a third, and hopefully restore respirations. And what the drug does, what the Narcan does, is basically it just overrides the opioid. And it takes away that drug's ability to slow the respiratory system down. The paramedics on the ambulance, they provided in IV form. In other words, they can give them an injection, which is a more potent override of the system. But still, what we do works. And since we started carrying it in 2017, we've administered 20 doses, and the police department carry it. We probably administered a good bit of theirs, and they've administered a lot. So the drug is out there. The Narcan is working. It's very easy to use, and it makes a difference in the long run because Basically, if our guys can revive them, get them to the hospital, I feel like it makes a big difference for guys that are trying to help these people. And you're exactly right. You know, we arrive at these houses, and they've got children, they've got families, they've got responsibilities, and basically this drug just ripped their life away. And a lot of them are in chronic pain. They're not just making this up. I mean, a lot of them have chronic issues and chronic pain issues. They're not bad people. They're just in a bad situation. And the Narcan has made a difference there.
And now, Brian Gibson, counselor at Willowbrook Tanner Health System. How have you seen the opioid epidemic affect Carroll County and West Georgia?
So I'm kind of like Shane. We tend to see guys when they come in and they are seeking help, either because they've been adjudicated and are being told they need to go and get some help, or because family members or someone else, or maybe because they've decided, I'm just tired of living life this way, they've come in to see us. So we kind of see it after that immediate crisis a lot of times. Our ERs, though, we see a lot of people come in that are being brought in by fire and rescue, and trying to get over and talk to people in those moments and talk to families to make sure people get into treatment has probably been one of our biggest struggles. One of the statistics that I'll bring to the table right now is in the state of Georgia, it's estimated that 90% of people that have been shown to need treatment because of their abuse issues aren't getting it. The biggest fight that we fight is the fight over stigma. You know, nobody wants to go to somebody and say, hey, look, I've got a problem with this. They think it makes them look weak or stupid or something like that. And so when we see people come in, they've known for years that they needed to come and get help. It's just taken a crisis for them to get that help. So what we typically do see, though, is we're seeing a lot of people that are using prescription pills, and at some point they start overtaking that medication. When they do, a lot of times their doctors will say, hey, look, you're abusing this. I'm not going to prescribe this for you anymore. And at that point, these folks are left to fend for themselves. That means that they're going to go into opiate withdrawals, and opiate withdrawals are about the sickest sick you could imagine. You're going to feel like you're dying from it. And there are a lot of insurance companies out there that unfortunately will not pay for you to go into treatment to deal with opiate withdrawals. That's another fight that we face. So they're left on their own to try and find a way to do this, and one of the ways they find to do it is a friend or a family member, somebody out on the street. You know, when these guys talk about the black market, they're not necessarily talking about, you know, some shady alley somewhere. They can be talking about your neighbor. And they start getting things from their neighbor or their friend or the guys they pal around with, and it goes from there. The problem is they're really expensive. Heroin's really cheap. So we see a lot of times that transition from pill use to heroin use just from a financial aspect. They can't continue to do that. So we get guys when they come in and they've used up all their family's resources. They've been in the hospital multiple times. You know, the threat of death has not been the thing that has stopped them more often than not. Usually it's somebody else coming and saying, we have to do something right now. And, you know, there are a lot of guys that'll come in that'll actually say it's our law enforcement officers that have been the ones that have reached out to them that said, hey, look, I arrested you, but I know you need help. You know, I want to get you in to see somebody. And there are a lot of guys that are in this room that I know that do a lot of personal outreach with their own time that are first responders to try and make that happen. So I'd really like to give a hand to you guys. You see it when people really don't want to be talking to anybody or be seen, and you know, the care and compassion that our law enforcement in this county has shown is outstanding. So thank you. Outside of that, really getting families into treatment, knowing that it's not just the person that's in recovery that needs some sort of assistance. Family members are spent. They don't have anything left. They're tired. They don't know what they did to cause this. They don't know how to control it, and they're trying their best to cure it, and they can't do any of those things. So making sure that, that we get them into some type of treatment themselves is also important to us.
And thank you for your input and opening statements. And just kind of to follow up with some recent news events. First off, they're having a similar event like this one in Atlanta. And if you have not heard, Melania Trump and President Donald Trump will be in attendance there today. So it seems to be on everybody's mind, not just right here in Carroll County, but on the nation's. And yesterday, actually, two major pharmaceutical executives were charged criminally with advancing opioids for profit. Obviously, maybe stopping the production is one area where we can improve this epidemic. Just before we get to audience suggestions, because we do have a little bit of time, what are some of your suggestions on a local level that we can do as a community to stop this epidemic in its tracks? And whoever has a answer first. Looks like Mr. Sims.
Yeah, lucky me. Well, you know, Pandora's box was open in the late 90s when pharmaceutical companies created these opioids and said that they weren't going to be addictive, they're not dangerous. And then here we are in 2019 with an epidemic. And I did read that same article as well about the two people that were arrested with the pharmaceutical company. They're just now starting to hold some of these pharmaceutical companies responsible for, you know, I don't know how else to say it other than flat out lying to the American people and to the government. So one of the ways that we're going to have to control the amount of the pharmaceuticals that are being administered to patients, and that slows it down some. And then it's incumbent on people like myself and Paderis to do the black market investigations to catch those people that are selling it to people without prescriptions, you know, or making it themselves. Fentanyl, which is a synthetic opioid, it's not got heroin in it, is stronger than heroin, and it's being made right here in the United States just like meth used to be made. So that's a whole new form of investigation. It's a whole other set of training. For Paderis and I, when we deal with investigations that deal with fentanyl, we can't just go and arrest somebody that's got fentanyl, put it in an evidence bag, and carry it. We actually have to don safety equipment and prepare ourselves not to be exposed to the fentanyl ourselves. So for us, we're having to go about all new training and look at it from a whole other perspective ourselves as far as that's concerned. Now, how we're going to slow it down, law enforcement's armed with a few different charges that we can use, but we're still limited if it's a prescribed medication. So I think it's going to be a combination between somehow or another controlling the prescribing of the medications, the filling of those medications at pharmacies, and then with our assistance in the black market, I think would slow it down some.
Any thoughts from our Detective Paderis?
Yeah, well, just to expand on what Brian was saying, you know, when we discuss this amongst ourselves and just what's the answer to the problem, you know, there's always going to be drug dealers, unfortunately, and we'll take one down, another one pops up. It's supply and demand, unfortunately, right now. But what we can try to control, or what we believe has a huge impact, is, you know, the doctors, and unchecked doctors at that. You know, we wish there was a little bit tighter pressure on prescription limitations or what they're allowed to prescribe over prescription, as well as pharmacies that are distributing this out. There are databases that are available to doctors and pharmacists that allow them to see who's been prescribed what, to the amount, different levels of it, to see if they're doctor shopping. And what we don't know, me and Brian, and I'm sure everyone here, is we don't know how controlled that is. Are they being held accountable to make sure someone's checking these things, to make sure folks aren't, you know, doctor shopping or getting overprescribed? And that's a start, you know, and that's not something that maybe me and Brian can do, but that's something that I think us as a community or even as a nation can put pressure on our representatives to start making that an issue. Just like when they raised hydrocodone, an opioid-related medication, to a Schedule II, that did great things for us. That kept call-in prescriptions from happening. Once upon a time, you could call in a prescription for hydrocodone, and if you had the right numbers, the DEA numbers, pharmacists would fill that, and somebody would come up and actually get those. And when they increased that to a Schedule II, now you actually have to bring a paper copy with you, or it has to be e-filed. And that dropped the amount of cases that we were getting at least in half on those fraudulent prescriptions, fraudulent calls-in prescriptions, and things like that. So we do think a little bit of accountability on who's prescribing this stuff will make a huge impact. And then I guess it's up to us to try to keep the black market and the pill mill stuff down as best we can. And the public can help with that, with education, and then not being afraid to talk about it. We do, yeah, give us a call. It can be anonymous. We've got Crime Stoppers. You can call us directly. And unfortunately, there's only so many of us working, and we can't see everything. And as abundant as prescription pills are, just like the gentleman said, it can be our neighbors, it can be our friends that get caught up and need to make the extra money to support their own habits. So as we see this as a community, we ask you to reach out to law enforcement, give us a heads up on who's doing what, and we'll do our very best to take care of the problem for you guys.
I think too, if we if we just look around us, I think we can all say in here that we all know someone or have someone that has struggled with this. I can't remember who said it, but it is among us, and I think it can start too as well in our homes and in our families and into our communities. If we just start looking around, we all have that thing inside of us that says, something's not right. Maybe if it is directly in our family, or maybe it's someone that we know close to us and it may be affecting their family, is to start trusting that gut instinct that we all have, or maybe a friend's confiding in us and confronting the issue. Because I think a lot of times we as people, especially in our society today, we don't want to offend anyone. To start confronting the issue when we probably know inside of ourselves that something may not be right, whether it's in our direct homes or in our families, in our cousins, wherever it may be, to start kind of confronting that and hopefully, because a lot of us, as a former addict, I struggled for 20 years with addiction, period. I did it all. I unfortunately, one of us was saying that, believe me, I never got to the heroin just because I jumped off and got myself some help before I got to it. But I was heading there because, as far as my family, I was literally draining our family financially. And that was my next step, was the heroin, because it was cheaper. And thank God that I never got there, because I promise you, if I would have, I would have jumped right in there. But I think for us too is to confront it and hold each other accountable, call each other out, be real with each other, and yeah, we're going to get some kickback. Promise you. Anytime my wife and she's sitting in here today with me, thank the Lord. But promise you, anytime anyone ever held me accountable, I was irritated and mad because the truth was coming out and the reality was getting exposed in front of us, and I didn't like that. I didn't want to be exposed for what was really going on. So I think that too is really observing, and when you see things in your home or with your family or with your friends or whoever it may be, your acquaintances, if you see that stuff, one of the things we say at the Blake House with the guys is like, is we tell each other a lot of times we love each other, but by God, when it comes time to really hold each other accountable, we'll steer from that. And we say we love each other, and we see it all the time with families because we deal with the families. I think it was Brian, right, Brian? Brian was saying that the family is just as sick as the addict. You hear a lot of these moms all the time say, well, I just love Johnny, or I just love Shane, or whoever it is. And the truth is that they're loving him to death because they're, and we tell them, like, you do love them, I know you do, but you're loving them to death if you don't stop enabling, and if you don't stop codepending, if you don't start calling them out on their stuff and exposing them for who they really are and what they really are. And we don't like it, but I'm telling you, when we start really doing that and not worried about how we're going to make them feel, because I promise you, as an addict, they already feel terrible about themselves. That's one reason that they continue to shove large amounts of drugs in their body, is because really they're just trying to numb out what they already feel in reality, which is a lot of shame, a lot of guilt, a lot of frustration, a lot of anxiety, and we don't want to feel that. So we shove a lot of medication in our body. I know for me, that's the only reason. It all started as I got hurt on the job one day, and my sister took me to the doctor. A family doctor of ours prescribed me a very low dosage of hydrocodone. I went home, I took it just like the bottle said. No ulterior motives. I remember sitting on the recliner, and I got high as a kite. And I was 10 years into an addiction already. I had abused cocaine and meth and marijuana, and I had basically did it all. And I got high as a kite. I was numb, and I really enjoyed that feeling. And then what that created was, like what we were saying, you know, I was the doctor shopper. I was the guy that would break into your house. I was the drug addict that would steal your wallet and help you look for it. And so it's just the truth of it. But I think that we have to start confronting that in our families as well.
And before we move on to audience questions, did Mr. Gibson, you had something to add really quickly?
Just, from a really practical standpoint, Detective Paderis was talking about one of the biggest things that they run into is just prescription pills in general. One of the things that we as a community can do is we can start advocating for ourselves. When you go to your physician and they prescribe you, or your dentist, we hear a lot of people, and they prescribe you an opiate, one of the things that you can ask them is, why do I need this particular medication? What is your plan for me with this medication? How am I going to get off of this medication safely? How are we monitoring this? Is there something else that is non-narcotic that I can take in place of this? And one of the other really basic things, you know, I used to work with teens a lot, and inevitably we would have teens that were coming in that were addicted to opiates. Almost across the board, they all said the same thing when we said, where are you getting this stuff? Medicine cabinets. After the first one of these talks that I did, we went back home, my wife and I went through our medicine cabinet. We found bottles in there from 10, 15 years ago that we had, you know, you don't need it, so you don't take it, and it just lives in there. And I promise, if you've got kids, they look through your house, they look through your stuff. At some point, they're going to come across that. There are pill return places all over the place, at pharmacies, at police departments, all kinds of things like that. Just from a really basic standpoint, clean out your meds if you don't need them.
And thank you for that input. We are now going to turn to some questions from the audience. And to help me do that, we have Colin Worthington, News Director for WLBB.
Thank you, Luke. I think on your table, most people find index cards, and they put them up there before they began talking. So if you do have a chance to ask a question, perhaps you came here with a question, perhaps these gentlemen gave you an idea for a question. But fill those out, and we'll come around and grab those for it from you. All right, I think we're going to close the door on the questions now. Now, if you do have a question, they're based on something that you may have heard here today, please throw this our way. I had exchanged emails, texts with a young lady about 2 weeks ago as we talked about this event coming up, and her question was she had concerns about local resources for family members who are dealing with people who are dealing with opioids. Any local resources. I think, you know, she was concerned that she can go on the internet and talk to people and things like that, but maybe those people on the internet are not local and facing the same issues that we might be in Carroll County.
So I can tell you one of the most basic services that we provide as a hospital system is we provide free mental health and substance abuse assessments to anybody that wants to come in. That is at zero cost to anyone. That it's at no obligation. We're not going to refer you just to Tanner Services to get people in our door. Anybody that needs help can come down to see us at either an ER or at a Willowbrook location. We're going to get you in, we're going to get you seen, we're going to find you resources, we're going to follow up and make sure that that gets taken care of. We also have a 24-hour helpline number, 770-812-9551, and you can call that number and they will also connect you with resources. So just a really simple, easy way to do that. It's confidential. Nobody's going to know about this if people are worried about that, and they are going to make sure that you get at least an assessment, a level of care that you need to be at, and some recommendations for that.
I do want to mention the sheriff just told me a little while ago that on Saturday from 10 till 2, I believe, at Kroger, they're going to have a drug take back for pills. So if you have those laying around, you're encouraged to take those and take them to the DEA. They'll be up there Saturday again, 10 till 2. Something that I've talked with you guys about recently, the officers in particular. Once you guys do use Narcan, what is there a deterrent? What's the deterrent other than, they almost died, for them not to go back to it? Because my understanding is that once you use Narcan, unless they broke a law, they're free to go. And there's also laws that protect people who call in you guys to come out there, hey, somebody's passed out here. You talk about those laws as well.
Brian might be able to expand on this as well, but there are laws protecting people. The ultimate goal with our police department and law enforcement in general is the protection of life. So we understand that people do make mistakes. People are addicted to controlled substances. So when we do have to use Narcan, and me and Bill were talking about it earlier, a lot of times they're let go. If they don't want to go to the hospital that day, we can't necessarily force them anymore. We can't require them to go to the hospital and seek treatment, whether it be psychological or physical treatment for their issues. So they make that choice. Our job is just to help them, make sure that they're going to survive the incident, and then try to persuade them as best we can to seek help. And again, we try to educate ourselves just like you guys are today at the resources available, people that we can get them in contact with, or notify family and get the family to partner up with us on that. And there are also laws protecting friends and family from calling law enforcement in reference to an overdose. We're not going to take somebody to jail because you called and either having an overdose yourself, you have taken too much of your illegally obtained medication or heroin or any other kind of drug. We're not going to seek charges on you. Or if you're reporting that as well for a friend or a loved one, the same applies. There's laws in place that protect the public and the community from being afraid to do those things. So again, our biggest goal, our number one job is that protection of life and saving lives. So that takes precedence over actual prosecution or making cases. Again, help the users, put away the dealers. That's our goal.
To go a little bit further on what he was saying about the law, it's not just the legal obtained drugs that they may have overdosed on, but it's also the illegal. If there's illegal drugs there, we're not going to be charging them for the possession of those illegal drugs because we're there for the safety of their life. That doesn't mean that we're not going to seize those illegal drugs and take those in our possession. Something else that we'll do when we respond is start interviewing friends and family and seeing just how far this addiction may have gone, if it's even an addiction at all. It may be just an accident. So, and we do try to provide some other resources and advice on how to get those resources while we're doing our interviews with the friends and family.
You got to understand that if you successfully administered Narcan, you've taken away their high, and they're immediately in withdrawal. And I don't know the percentage, but it's not uncommon for them to get out of the ambulance and leave. It's not uncommon that we'll get in a spell that we go to the same location multiple times in a month or a week or two. And then eventually the people either move somewhere else, they seek help. But just remember, when you successfully administer Narcan, you've taken away their high and they're in immediate withdrawal. And they're not happy people. So they'll get out of the ambulance and they'll leave. And there's nothing that we can do to stop them.
Sticking with Narcan, for both the city and the county, do we have numbers of Narcan use annually?
Since the program began in 2017, we've administered a little over 20 doses, and the police about the same. One thing about it, the ambulance response is usually 3 to 5 minutes, so after we administer the initial dose or two, we'll generally provide respiratory assistance, and then by that time they're there. So that's kind of the numbers.
We do attribute some of the numbers and statistics we found with the overdose deaths from 2017 to 2018 went from 5 to 1. We like to attribute that, or at least we think we do, to the Narcan use and the ability to have that stuff present. So hopefully this stuff's working. It's saving lives. As to the original first part of that question on whether or not it deters people from using it again, or if it gives people that warm and fuzzy because they know Narcan's coming or it's nearby or close, we don't know. Sometimes we like to think, that close call to death will wake people up. regardless if you made it through or if Narcan worked. I'm sure there are some individuals out there that feel like it's a lifeline that's always available for them. Our goal is not to really examine whether or not the psyche of that has an effect. It's just to make sure we have it to save those lives. And like Bill said, this stuff's going to make them come out of their high, and it normally ticks them off pretty bad. I mean, they're down at the very bottom of their DTs, and they might be very angry. Some of them might be violent, get sick. They're not happy when that stuff happens, so perhaps that's a deterrent as well when they use that stuff.
I got a question regarding doctor shopping. Do you believe there's a greater prevalence in West Georgia area due to access to a different state so close?
Yeah, I do. Obviously, I-20 is a corridor. I-20 is a haven for everyone from Birmingham to through Atlanta and through several states. So if somebody's on a mission to doctor shop, they're going to hit those main corridors and thoroughfares and start hitting city after city after city that's close along the way. And again, not all states are a part of the same program. Like pseudoephedrine, once upon a time with meth use, we had the biggest issues across Alabama and Georgia on trying to get on the same database. So there's just bugs to be worked out to make sure that this stuff can be identified when people cross state lines or counties and doctor shop. But it's definitely here. It's definitely a big problem, and we do contribute that without a doubt to I-20 in Atlanta, without a doubt.
This is probably targeted you, Detective Sims. Are there any programs available in Carroll County's jail for addicts?
Our jail currently has a medical staff that does do evaluations when they're brought in. If they know, and I say they, as in the law enforcement officers that are delivering them to the jail, know ahead of time that they are dealing with some type of withdrawal or they're having addiction, then that medical staff will then do the evaluation, and then they'll go forward accordingly.
What are some things that communities, individuals, people here today, may not have a family member who is, facing this kind of crisis, but just the community as a whole, what can they do to try to curb this?
I mean, I would say just awareness, of what's available in our community, whether it be, a program like the Blake House or Willowbrook or, just figuring out what is available. And so I would say awareness of that. We are here. The Blake House is available. But a lot of these guys, like I said in the beginning, we're the last resort, really. Guys are at a pretty bad place when they call us. So, if you got guys that are, just starting to experiment, a young 18, 20-year-old maybe has smoked some pot or, just kind of getting going, facts are he probably will not make it through our program because it's very structured. It's a minimum of 10 months. It's an in-house residential program. So, and he's continuously having to look at himself and look inside of himself. But I think to answer your question, Colin, is awareness of what is available.
Doing things like this, coming out, getting education. I'll say one of the big things we see bring a lot of our guys in is that their employer has an open door policy related to getting help for addiction issues. A lot of our folks get their insurance through their employers, and they're usually pretty terrified about what's going to happen when they go and they talk to somebody. Having an EAP program or a human resources department that is making sure their employees know that they can come to them and that they can get help for this is a huge part of this thing. And really trying to change people's minds about what this looks like. I joke with people and say, hey, if I go into a group of my friends and I say, look, guys, I've decided to quit smoking, they're all going to tell me, congratulations, good job, way to go. That's going to be great for you. And then if I say, but no, crack, they're going to look at me differently. And they're going to say, hold on, what do you mean? Well, it's the same thing. I've decided to make a positive change in my life. I've decided to do something that ultimately will keep me alive longer, keep my family fed, keep my family under a roof, and make sure that I don't wind up in jail or broke or on the street, something like that. It's changing that stigma, and I think everybody that is in here is working on doing that right now. So talk to your friends. When you hear them say something on Facebook like, I don't know why we give Narcan out. Those guys, you know, this, that, whatever, we should just let them die, which I see all the time. When you hear that kind of stuff, talk to your friends, confront them on that. Ask them, is that really what you think?
Well, I'd say the doctors are not the only, we've talked a lot about doctors today, but they're not the only source of this problem. I mean, you talk about fentanyl coming in. I think I talked to Brandon a while ago, and I think the most common source for that, I believe, is out of China. So this question is pretty direct. How can physicians be held accountable for over-prescribing opiates?
Oh, is it? All right. How can physicians be held accountable for overprescribing?
And I guess what's the process of finding out and determining that a local physician is overprescribing?
Yep, so, and Brian made mention of it, his group actually has pill diversion groups and units that actually investigate doctors specifically for overprescribing medication. We've worked cases, Investigator Browning worked a case a while back. These are things that we do look into. It's just sometimes they're difficult and they take a lot of resources. We do have to reach out for support through the state levels, through the GBI and so forth. If we suspect a doctor in our area is overprescribing or is purposefully, prescribing prescription medication for the purpose of making illicit money or what have you. So it's definitely there. We try to hold them accountable as best we can. There are some big groups that go out and do undercover purchases and see doctors and doctor shop to see if any of these doctors will actually deny them medications. That's something I wish we could do more of. Again, resources kind of keep us in check a lot to do things in our area, but when we get those complaints, we have resources like the GBI, Hightower with the DEA that we have officers attached to, and we can reach out to them and request them to do a more detailed and thorough examination of a doctor's office or a specific doctor. Beyond that, again, it's trying to just tighten that restrictions as best we can and holding doctors in general accountable, for just the prescription in the doctor shop. And it may not be one specific doctor. It could be 20 doctors in the area that have no accountability of what person might show up to each office, get a prescription, go to the next one, and go to the next one, and go to the next one. So as long as we can continue to educate ourselves, we can reach out to our representatives and legislators and try to make it a little harder on them to overprescribe this stuff and have other options available.
It's not just the doctors and the prescriptions. When we go to some of our investigations where we're doing the searching in the house and we find the pill bottles, there may be 4 or 5 different pharmacies as well that they've gone and gotten these prescriptions filled in, and they'll have 3 or 4 different doctors' names. And Darius and I had talked before coming in here today that one of our biggest wishes would be if there was a network somehow or another that when one patient decides to go to this doctor and they put the information in, and then when they leave there with their prescription for 130 opioid pills and they ride down the road to the next doctor, that someone in that office be able to put that name in there and see that they were just at another doctor's office. Right now, to our knowledge, that does not exist. I don't know if that's even capable of something that can be done. Now, we do know that with pharmacies, if they do have that capability because they do it with the ephedrine logs now. If a pharmacist sees somebody come in with a prescription and then they go down to Walgreens after leaving CVS and Walgreens puts their name in there and realize they just got a prescription filled for 130 opiates, then they can also help control it. So that's our wish. We don't know if that's really something that can ever be put in place. There's a lot of laws to be looked at in that.
We've got about 15 minutes left. I'll ask 2 more questions, and I'll turn it back over to Luke to wrap us up. What are the warning signs of opioid abuse versus, say, the signs of using crystal meth or anything else?
So we see a lot of our guys start off with really basic things like they will stop doing a lot of the stuff that they used to be involved in doing. If they were playing sports, they stop playing sports. If they were going out with their buddies, they stop going out with their buddies. Their peer group can change. Maybe if they go on vacation or you go out of town, they wind up being sick every time they do. They're calling into work more. Again, being secretive, hiding things, lying, a lot of things like that. As far as symptoms related specifically to opiate use, we have a lot of guys that run out of their opiates and they'll go into withdrawals for a couple of days. So if you see a family member that you know has been prescribed pain pills, that they are starting to have things like GI issues, diarrhea, all kinds of stuff like that, that's typically going to be a sign of opiate withdrawal. And if they're in withdrawal and they're prescribed something that's a maintenance medication for a back injury or something like that, that might mean they're overtaking it and running out of the pills early. So being able to ask them, hey, look, are you out of your meds? If they're complaining about being in pain more often, if they're asking to go back to the doctor again, just really basic things.
Irritability is one that I notice a lot in guys, but just behavioral stuff. It's very obvious if you're aware of it. It's really, a lot of times if we're not aware of it and we haven't been exposed to that behavior, we might not recognize it, but it is very erratic behavior. I mean, Brian pretty much summed it up, but a lot of highs, a lot of lows, and the effects that the opioids have on people can be different. Sometimes the effect can take a person down, kind of mellow them out, maybe make them go to sleep, or the effect can be somewhat of the effect of meth. And I always use myself as an example. Anytime I took opioids, it would wire me up. I would be cleaning the house. I would be sweating profusely. So if you see a lot of sweating, things like that, but it would be a very high for a couple of hours, and then if you did not retake or take some more to kind of keep you there, then it would be an obvious low. But definitely a lot of everything Brian said, the relationship changes. Just the normal everyday stuff that we do, the addict of opioid use, his behavior is going to be completely different. Job losses, or maybe even constantly changing jobs because of unhappiness and just a lot of erratic behavior.
All right, I lied to you, Luke. I actually have two now at this point. Last two, I promise. This is probably for the officers, and it's an opinion question, so you're kind of putting yourself out there. How do you believe the marijuana cultivation bill will affect the increase or decrease of opioids?
The cultivation of marijuana, increase in opiate use?
How do you see that affecting the opioid use?
To me, from my perspective, it kind of runs hand in hand. I don't know that one's going to lead to a greater use of the other. Marijuana traditionally has been used with every drug that we've ever dealt with in the past. So,
but if they use it as a painkiller, do you see them turning to that more so than opioids?
Well, I don't have the medical background to argue one way or the other whether or not that truly works or not. But what I can say is that marijuana has been used for a multitude of different uses, anywhere from just simply wanting to be high to used as a painkiller, if you will. So whether or not it leads to the excessive use of one or the other, or the reduction of use, I'll have to wait and see what the stats say down the road.
Yeah, I would agree. It's all about moderation. You guys know some people were drinking grandpa's cough medicine, back in the day, and alcohol as a pain relief. Prescription medication, hydrocodone, oxycodone, the people that take it correctly are getting relief for problems from a doctor. It's that sense of moderation. The cultivation bill, that applies to specific medical marijuana, that less than 5% THC, CBD oil that's legal right now in the state. It's going to be very minimal effect on any of the narcotic issues that we have until recreational laws and things start to be applied to our state. So we're not there yet. And we always get asked the marijuana questions and at most of this stuff. Again, I would argue responsible people with anything, whether it be alcohol, whether if marijuana is legalized one day, whether it be prescription pills, is one thing. But when it leads to that addiction, when it leads to overuse, when it leads to that recreational ability, we start seeing really staggering effects of it. You know, you see things like you do in Colorado where children, you know, as young as 10 and 12 are using this stuff. People are having accidents, getting hurt, overdoses are skyrocketing, et cetera. So it all does play hand in hand. I think it, you know, everything's a gateway to each other, and once you step over that line and cross into that world, everything opens up to you.
All right, this will be the last audience question. Thank you for filling these cards out. I hope I got to most of them. This will probably target Shane. I think it might be good to answer this. What role does faith play in the lives of a healing addict?
Probably the only way. I would say the one thing that we've experienced, and we are a faith-based program, a Christ-centered, you know, drug and alcohol program. I would say it's the only way that we can possibly beat this thing is, I'm going to take it back to, I don't want to get real religious here, but I'm going to take it back to a personal relationship with Christ, is what we have seen personally and firsthand really be the thing that really helps these guys is helping them establish a foundation. And because these guys, when they walk into our doors, the one thing that we see is they're in an identity crisis. They have no idea who they are. One, they have no idea who they are in Christ, but they have no idea who they are. And so that's where we really try to start tapping into what are some of the deep-rooted issues. Because the thing that we've experienced the most is that drugs and alcohol aren't their problem. When they walk in their doors, that's one of the first things. When we do a interview with these guys, when we do a face-to-face interview, we'll tell them that drugs and alcohol aren't their problem. You know, they're their problem. And we start getting them to look into why are you using drugs and alcohol. And we start introducing them to Christ, and along the process, we start letting Christ kind of tell them who they are. But the thing is that they have no idea who they are. So, of course, the drugs are just a byproduct of what's really going on deep down inside of them. And we start, that's why we need at least 10 months with them, because a lot of these guys, when they come to us, they've been in an addiction for a very long time. It's not like these guys have been in an addiction for, you know, a year or 2 years or 3 years. These guys have been in addiction for 10, 12, 15, 20 years. And so there is a very established belief system when they walk in. Unfortunately, that belief system's very, very jacked up. And that's where we start, you know, we kind of are able to box them in. We don't hold them there. They're able to leave anytime they get ready. You can walk out the doors anytime you get ready. But we start challenging them to looking into, and what we've realized is a lot of this stems back from their past and a lot of their environment as a child or circumstances that they faced as a teenager. And there was a belief system. I think we all can say that. I think what they say is our belief system's established by the age of 12 or 13. I think pretty concrete. And a lot of these guys have. The sad thing is that they bought into a big old fat lie about themselves that's not necessarily true. So, to answer your question, we feel like that the only way they're able to get that true freedom from what is ravaging them is that relationship and that foundation that they need to build on and stand on. So.
And we would first like to wrap up this program. It's about 12:55. Thank you for joining us on your lunch hour. I'm sure a lot of us have to get back to work. Thank you again for joining us. We'd also like to thank City Station for allowing us to host our event here. They've been a great partner of ours in this endeavor. And before we go, please let's give a big round of applause for our panelists. They've been very enlightening. Thank you very much, gentlemen. And also, the Opioid Crisis at Community Response 2019 could not have happened without our gracious sponsors. And a big thank you to the Carroll County Sheriff's Office and Sheriff Terry Langley, the City of Carrollton, Hightower Family Funeral Homes, Farmers Insurance, Toby J. Powers Agency, and State Senator Mike Dugan. Thank you guys for allowing us to put on this great event. A big round of applause for them as well. And lastly, we'd like to thank you, our audience, and everybody watching on Facebook. As Mr. Gibson said earlier, the first step is just this, getting educated and beating the stigma, and I think that we've taken a great step forward toward that goal, and hopefully we can end the opioid crisis indefinitely in the future. Thank you guys again for coming out, and this was brought to you by Grata Communications. If you missed anything, you can log on to Facebook Newstalk 1330 Facebook page and watch it all over again. Thank you.